Hello, this is Dr. Abdelrahman Salem from Brooklyn, New York, Doctor of Physical Therapy. Today I have my friend came in with the knee pain. When I examined, there's a way to find out, okay, this was moderate knee fusion. Patellar floating test was positive. When just I squeeze the fluids with my hand here and I press with the press with the thumb on the patella come down, come up again. This is, for me, is moderate knee fusion. And if you go here, the other knee, see, the breast, nothing. But the patella rested on bone. Here, patella is floating in a fluid. So what is the best way to treat this? I think most of the cases, God willing, going to work and help him. If we do the quadriceps drill, but we need to do actually like 300 times a day. Quadriceps drill is very easy. It doesn't take time. It's going to help with this knee fusion, which is tighten the knee and relax. Can you just press on a pillow and make your knee tight? This is the way to do the quadriceps drill. Make it tight. Tight. You can hold for 10 seconds. Relax 10. You can hold for 10. Relax 5 seconds. Relax. The longer could be the better, but the ideal is do 10 and 10. Contract. Relax. Contract. Relax. Okay. When he started doing this by himself, he was having sharp pain under the patella. So if your patient has knee pain or patellar pain with a quadriceps drill, this is the way to treat. I take this mobilization belt around my waist, like it around my waist, and this is the way you're gonna see. I put the belt, start the belt behind the knee, and take the tibia lateral, and this is the proximal end. Take the femur medial, and you strain, and now tightens here. Okay. Relax. When he relaxes, I relax. When he tightens, I tighten. And this is very easy. I'm not using my hands. I'm not straining my body. I just use this will help. Relax. I just move with my body out. Just stabilize here. Stabilize with my hands. Just move with my body this way. This, I'm rotating the tibia lateral and rotating the tibia medial. Not only rotation, but will be tibia you rotated laterally, and you do lateral glide as well. And for the femur, you do medial glide. See this? This is the actual movement. Lateral glide with lateral rotation in the tibia, medial glide with medial rotation in the femur. And I can do this with my body, so I can have free hands to stabilize, use whatever I want to do. And as soon as we did this, we did 20 repetitions. The pain with contracting the quadriceps or the quadriceps drill was much better. We did 20 repetitions. I did it freely, was better. We needed to continue another 20, so it'll be 40. But at homework, at home, plus the cold compresses, 10 to 20 minutes. Do it if you can do every 2 hours. Do it up to 20 minutes. If you cannot do it two, three times a day, the more the better. It's going to help. But you do this daily, actually like 300 if you can, because it doesn't take time. If you can do it watching TV, sitting with the family, and you're relaxing in your bed, reading newspaper, checking your messages, you just keep doing this. Do it again. Now relax. Now one thing more I want to show we found today. For the knee joint is actually the knee is several joints. We have the patellofemoral, we have the tibiofemoral, we have the tibiofibular. Okay, so I'm talking now at the patellofemoral. When I examine the auxiliary movements, look with me here. I can move the kneecap medially, laterally, freely. See, laterals go very well. Medially, it's kind of limited, but it moves. See, this auxiliary movement should be happening freely. This is not bad at all. But look for the cephalocaudal. Look to the movement. I'm supposed to be able to move the kneecap down and up. Actually, it's much better than we started the treatment. Before was no moving at all. Now I'm regaining the perpendicular patellofemoral movement. We should be able to move the patella passively on the femur, up and down, with no restriction at all. In the beginning was zero mobility, was too restricted. After we did the quadriceps drill, mobilize it a little bit, but we need to do this passively several times. You can do like up to 40 times. You 2 fingers here, you move it, push the patella cephalic up, and you 2 fingers here and you push it down, up, down. You do this 40 times. We need to mobilize patella in order for the physiological movement to happen, which is a functional movement, to happen freely with no pain and difficulty. The auxiliary movements should be happening freely first. This is the auxiliary movements for the patellofemoral. But the auxiliary movement should be medial lateral, perpendicular up and down. It will be diagonal this way and diagonal that way as well. Okay. Share it. So many people need this information. So share it with your friends, and press subscribe if your first time to subscribe, and press like if you like. We need more likes, and watch more videos. Bye now.